717, the FDA is now reviewing a new study from this week finding toxic metals in tampons. We reached out to the department and they told us in part, quote, "We plan to evaluate the study closely and take any action warranted to safeguard the health of consumers who use these products." Now, the department also cited that all studies have limitations, but it is certainly something that put many women on alert. So we want to bring in a doctor, Dr. Mary Melancon, an OBGYN from Medstar Washington Hospital, for more. Thank you so much for joining us, doctor.
Good morning, Marissa. Thank you for inviting me.
Absolutely. Break down for us what was in this study and what we should take from it.
Yes, so this was a study, first of its kind, from UC Berkeley, published in Environment International. And the objective of the study was to determine the presence of heavy metals in tampons. They were not looking to determine if the heavy metals were absorbed through the vagina into the system. They were simply looking at whether or not the tampons contain these heavy metals. They looked at 14 different common brands in the US, the EU, the UK, and all of the tampons did indeed show these heavy metals. In low levels, they're not sure whether these were contaminants from the processing, perhaps from the soil, or whether they were deliberately inserted during the manufacturing as antimicrobial agents or whitening agents. But it is something that is concerning. Much more research obviously needed.
I know that it focused mainly on tampons, but are we seeing some of those same heavy metals in other products, sanitary pads? You have the menstrual cups and various other things that are out there?
Sanitary pads are made of the same products, cotton. The menstrual cups act differently. They actually are a reservoir to collect the menstrual flow, so no concern there. And that is a reliable alternative that women can use to tampons or sanitary pads. It's a very common product that women use. 80% of women manage their menstrual hygiene monthly using tampons. So we definitely need more research to determine if this could have long-term health consequences for women.
In the meantime, for women who do choose tampons as their go-to for it, one thing that I found is that the organic tampons, according to this study, actually had higher levels of arsenic than the conventional ones. So which one should you purchase if that's your priority?
Correct. Surprisingly enough, the organic tampons did have, as you mentioned, higher levels of arsenic, and the non-organic tampons had higher levels of lead. I would say at this time that women should continue to use products that they are comfortable with in terms of managing their menstrual hygiene. Again, there are alternatives such as the menstrual cup, the menstrual disc, reusable pads that women can use to also manage their menstrual flow.
Finally, doctor, are there any signs or symptoms that you want to warn women about? Say if they do notice a change that they should talk about with their gynecologist that maybe could be related to the sanitary product that they are using?
Correct. These products have been around for a long time. We've been using tampons since the 1930s, and fortunately, we don't see women coming into the office with any signs or symptoms such as heavy metal poisoning. So that is very reassuring for women. You know, perhaps some irritation could be noticed. Anything that they see that's outside of the norm, they should bring to their provider's attention. But this is cause for concern, but not panic.
Okay.
I think the biggest conclusion that we should draw from this is that more research is needed. The tampons are regulated by the FDA as medical devices, so the regulation isn't very stringent, and I think the manufacturers and the regulators need to collaborate to do a better job of being transparent, better labeling, so women can make an informed decision when they're taking these products off the shelves.
Thank you so much for putting us at ease. We talked about this for length in our news meeting, so a lot of people were concerned, absolutely. But Dr. Mary Melancon, thank you so much. You are an OBGYN from Medstar Washington Hospital Center, and we have to have you back as well. I thought you did a great, insightful job on a story that many, many, many are following. We appreciate it.
Thank you, Marissa.
Makia.
All right, that was a great segment. Thank you, Marissa.